My name is Dr. Shari Corbitt, and I am the CEO and founder of Agora Neurofeedback Incorporated and the Heart and Brain Center for Healing, an intensive outpatient program for women. Last time I presented, I discussed my very strong philosophy that individuals with chemical dependency, eating disorders, chronic pain, and significant mental illness should really be treated together, that the upside of communal treatment far outweighs the fantasy that these individuals can be treated separately, given that the moment that someone becomes sober, they will find another avenue for managing feelings, since that's what it's really all about anyway. So today, I'm going to briefly describe two of the individuals that we very successfully treated at the Heart and Brain Center for Healing. First, I'd like to briefly go over the case of an 11-year-old girl named Julie, whom I'll call Julie. Of course, that's not her real name. Julie originally presented with a very severe form of obsessive-compulsive disorder. She had both fears, emotional, mental fears, as well as rituals. Those are the actual compulsions, the behavioral manifestations. She also had uncontrollable tics that were driving both her and her family members crazy. They wanted to sort of tie her down as though that would be helpful. Of course, it only made it worse. At this point, this 11-year-old little girl was practically housebound, not because she was embarrassed by the tics, but because she was so fearful about leaving her home. When Julie was 9 years old, her grandmother died, and she was very close to her grandmother. But her grandmother's death was not the problem. The fact that Julie's parents and her grandmother made a decision that it would be too traumatic for Julie to witness the death process was what was traumatic. So in fact, Julie was separated from seeing her grandmother for over 3 months before she actually died. So the abandonment was long and protracted, and that's what she identifies as having been traumatic. And it was at that point that the majority of these symptoms began. So it would be very easy to point to that and say, we found the problem. But we have to go deeper. We have to go into her physiology, because in fact, Mom has a significant anxiety disorder, Dad has a significant anxiety disorder, and most of the aunts and uncles have significant anxiety disorders. So it's not enough, as you've heard me say time and time again, to do narrative therapy where we talk and talk and talk and talk and talk about the event. We have to address the central and the autonomic nervous system so that we can heal the deepest underlying biological layers of what's going on for this child. I don't mean to suggest that group therapy and individual therapy has not also been enormously helpful. And interestingly enough, the 67-year-old therapist on our staff has been the woman that has had the greatest impact, because of course, what we call transference, the grandmotherly relationship that Julie has created with this therapist has been enormously impactful. She had a total of 90 days of treatment. She has returned to her school, which is tremendously rigorous academic environment, and she's doing beautifully. Her parents have remained for parenting skills treatment. Parenting a child with severe anxiety is not easy, and so they've remained in treatment for additional support. Next, I'd like to talk about a gal I will call Donna. Donna is 49 years old. She is an executive at a major Hollywood studio. She came to us with addiction to pills and alcohol, but very willing to taper in an outpatient detox with her psychiatrist. With a binge eating problem. At the time, she was approximately 140 pounds overweight. severe PTSD that she had been struggling with for most of her life. Symptoms included nightly nightmares, flashbacks, severe insomnia, which included difficulty falling asleep and staying asleep. Soon into her treatment, it became clear that Donna was losing time. And what we mean by that is that she would go somewhere else, so to speak, mentally. She would start a conversation and then what you might think of as space out, but she simply would not be present. And then she would pick up a conversation that she had had 2 days previously with us. And we call that losing time. And that is a diagnosis called dissociative identity disorder. Now, how does one develop that? Throughout Donna's childhood, she suffered multiple, and I can underline multiple, intrusive medical treatments. And while she was going through these terribly intrusive medical treatments, she was devoid of any maternal or paternal emotional support. So her only supports were occasional transient nursing support, which was really certainly not good enough to protect her from the impending emotional backlash. She was an only child, few friends, and she was very socially awkward. She also has extreme intelligence, and she's also quite resourceful. She did not wind up at the very, very top of a Hollywood studio by accident when she frequently opens up her closet and doesn't know where several items of clothing came from, because she doesn't remember purchasing them. What occurred was, and this is not terribly uncommon, Donna learned how to mentally leave her body during mental procedures. This is, in fact, like I said, not uncommon. It's like when we are stabbed or shot and we don't feel it right away. That's physical shock. When we are in psychological shock, and if it occurs frequently enough, we will learn how to psychologically leave our bodies. Unfortunately, and as I have here in the final box, it generalizes. When we become uncomfortable in a social situation as a teenager, or we become uncomfortable in an employment negotiation, it begins to generalize. We begin to sort of go somewhere else, but we become adept at doing so. So we can be somewhere else, but the people around us won't know that. We can carry on a conversation. Now at this point, we are aware of 2 other alters that she has. She has an alter who is married, somewhat successfully, to her husband, and an alter who goes to work. She also has an alter who's a very, very angry addict. And all hell broke loose when she decided to try to be emotionally present in her marriage. So now she is truly finding her way back home in sobriety, in her marriage, finding her way back home to herself. She has named that as her theme of her treatment. Like I said, she's extraordinarily bright, so she has created a name and a theme for her treatment. She has been with us for quite some time now, and I expect that she will be with us. We will flesh out more alters. It would be highly unlikely to only have 3 alters. We will probably find many, many more. And ultimately, the goal will be, in her time, not ours, to integrate these alters so that pills, alcohol, rage, road rage, dissociating, blanking out will no longer be her go-tos, but actually speaking will be her go-tos. So thank you so much.